The personalities that matter with Keith Vaz on Talking Points.
Leica Radio.
Welcome back. This is Keith Vaz on Talking Points on Leica Radio. As I've said, we've got a big medical theme to our programme this week. My special guest today is a world-renowned physician. Professor Kamlesh Khunti is the Professor of Primary Care, Diabetes and Vascular Medicine at the University of Leicester. He's also the co-founder of the famous Leicester Diabetes Centre and leads a research group that is currently working on the early identification and interventions with people. He is now rated as the top diabetes specialist in type 2 diabetes in the world. He's also a member of SAGE, the government's advisory group, and he chairs the ethnic minority sub-panel. As well as that, he is the director of the UK National Institute for Health Research and Applied Research, dealing with collaborations in the East Midlands. He is a multi-award winner, having received awards in the United Kingdom, India, and most recently in Istanbul in Turkey. He joins me this morning from Leicester. Where else? Good morning, Professor Kamlesh Khunti.
Good morning, Keith. Thank you for having me on this program today.
First of all, many congratulations. We are extraordinarily proud to hear that you have been rated as the top diabetes expert in type 2 diabetes in the entire world. You must be very pleased with that.
It was a surprise, yes, but extremely pleased. And I think it's a really dedication to the work of our wider team here at the Leicester Diabetes Centre.
We'll come on to that in a few moments. Let's start with your early life. Born in Uganda, came to the United Kingdom at the age of 10 with your family. Do you remember much about your life in Uganda?
I don't remember much of the Ugandan life. I went to India between the ages of 7 and 9 and then came to UK when I was around 9 or 10. So I remember some of the Indian childhood, but obviously all the childhood in the UK is very fresh still.
You can still remember that. Because, of course, next year there's this big celebration all over the UK of 50 years of the arrival of the Ugandan Asians. Do you keep in touch with those groups, or do you think that's generational? That's really something that your parents would do rather than you?
Well, we came before the Ugandan exodus, but I did take my mum to all the Ugandan gatherings. Unfortunately, they're not with us now, but I'll probably try and attempt to go to that session when we have it in Leicester.
And your kids, how much do you talk to them about your early life? Because those of us who are first-generation immigrants, you know, with our busy lives that we all lead, you more than probably anyone else I know, do you ever sit down and say, oh, things were like this or that, or we did things differently, or is it now just all 100% UK?
I talk to them all the time. I'm very fortunate that we meet up and eat as a family on a regular basis, most Saturdays, if not every day if they're at home. And I had a very poor upbringing. I was brought up in the Highfields in Leicester, and I tell them about the difficulties we've had. But I think it's a different generation. You know, they're more privileged than we were, but probably our parents said the same, that they were more privileged than I was. So I think it's a generation thing. But I think it's very important that we do give them all the information, not just about ourselves, but our parents and grandparents as well, and the difficulties that they faced. Whether they take it in or not, that's a different matter.
Were there influences on your life that made you want to choose the field of medicine? Did you come from a medical background, as many of our doctors do, or is this something that you did on your own?
No, not at all. I didn't have any influence at all because my parents didn't speak English. They were labourers in a factory, and in fact they never came to my school teachers' events either because they didn't know how to speak to them in English. I think this is just through some friends who were applying for medicine. I thought that sounded like a good thing to do. I always enjoyed the sciences, and I was fortunate enough to apply and get into a medical school.
This is Keith Vaz on Talking Points on Leica Radio. I'm talking to the man who is now the #1 diabetes specialist in type 2 diabetes in the world, Professor Kamlesh Khunti. We're going to take a short break, and when we come back, we're going to talk about diabetes. Join us after the break.
Keith Vaz on Talking Points. Leica.
Welcome back. This is Keith Vaz on Talking Points on Leica Radio. I'm talking to the man who is now rated as the top diabetes specialist in type 2 diabetes in the entire world. And of course, as a type 2 diabetic, I'm very privileged to do so. Now, medicine is obviously a very competitive subject. I mean, it's always been competitive. I remember having people come to me with 3 A stars and they still can't get into Leicester University. How competitive is it now compared to what it was like when you were doing it? I mean, is it much, much worse now?
I think it's a lot more competitive now than it was. I think there's too many hoops to get through, even before you get to the interview. So as you mentioned, you need the 3 A stars. You should have done so many events, helped in nursing homes, etc. All the statements that you have to write, the attachments you have to do with a surgery or a hospital. Most people don't believe when I say I only have 4 GCSEs. I don't have any sciences. I went to an inner city school in Leicester that didn't do physics, chemistry, biology separately. So I ended up with 4 GCSEs, and one of them was Gujarati. And I was very fortunate enough to get into a university. I went through clearing at Dundee University. I don't think I would have got into any course nowadays because of the competition and what you need to even get to the stage of an interview.
Well, that's interesting. From 3 GCSEs, you've ended up being a world beater, top of the world, and your speciality is diabetes. What made you found the Leicester Diabetes Centre? Because obviously all GPs know about diabetes, but you created and co-founded a centre of excellence. Why did you do that when there's so many other demands on your time? Why that?
I started off as a routine GP in a city in Braunston in Leicester, but I was always keen on research, always keen on improving quality of care. So I became a trainer and a teacher at the practice, and then I thought, what next? So I got a post at the University of Leicester doing audit. And then I met Melanie Davis, Professor Melanie Davis, who was the co-director with me. We were both juniors at the time. We both had 1 researcher each. And our interests were very similar, working mainly with type 2 diabetes in the community. We had interest in ethnic minority populations. And I think that's what really sparked it off. And then over the years, we continued getting grants and expanding our team. So from 4 of us, we now have a team of 160 people. That's including the PhD students.
Do you think that Leicester, and particularly the ethnic minority communities, are more susceptible to diabetes than the rest of the population? And why is that?
Well, most of the data are showing that wherever ethnic minorities have migrated to, particularly South Asians, that they have a higher prevalence of diabetes compared to the indigenous populations. If you go to Fiji, went to Uganda, Africa, the Caribbean, the rates are exactly the same. And we see exactly the same in the UK. Our rates are about 2 to 4 times higher than the white population. The reasons for that are quite complex. We know that there is a genetic importance to it, but I think a lot of it's to do with our lifestyles. We are not as physically active, and we and others have shown that. Our diets are not as healthy, but I think we are improving there. And there is some data showing that there is an element of stresses in life. And I think overall migrants have more stresses than the local populations, and that may also play a part as well.
Now, in terms of the work that you do at the Diabetes Centre and more generally in the country for the South Asian Doctors Association, do you feel that someone going into medicine now, because there'll be lots of young people listening to this program trying to contemplate a life in medicine, do you think that they should specialise at an early stage, or do what you've done, which is do the work of a GP and then choose a specialism like diabetes?
I think I've had a different career path to what normal researchers would. If you want to go into research, it's now you have to be into a research field very early on. You need all the training programs. But doing some training as a generalist, so by a generalist, I mean a general practice, I think that would help in anyone's career. If someone wanted to be a cardiologist, someone wanted to be a geriatrician, a physician, gastroenterologist, I think the basics we learn extremely well in general practice. The patient contact, how we talk to the patient, how we identify patients' needs, the long-term follow-up we have, none of that happens in a specialist setting usually. So I think just the foundations of learning about the key characters of the population, that's what we see, general population we see in general practice, would be a good grounding for any specialty.
This is Keith Vaz on Talking Points on Leica Radio. I'm talking to Professor Kamlesh Khunti, who has just been rated as the top type 2 diabetes specialist in the entire world. Stay tuned. Join us after the break when I'll be talking to him about COVID.
The personalities that matter with Keith Vaz on Talking Points.
Leica Radio.
Welcome back. This is Keith Vaz on Talking Points on Leica Radio. I'm talking to the top-rated doctor in the world dealing with type 2 diabetes, Professor Kamlesh Khunti. Kamlesh, COVID has dominated our lives for the last 2 years. There's no doubt about that. Do you know many of your fellow practitioners who have sadly passed away because of COVID? And how do you cope with seeing your fellow professionals who are there to save lives succumbing to this dreadful, dreadful illness?
Personally, I haven't seen anyone extremely close to me who has passed away with COVID. However, obviously, we have a number of colleagues working in so many different specialties, including primary care, as well as the nurses and other staff who have been affected by COVID. And it is really, really sad to see. I mean, when we first started looking at the figures, and we were quite astonished, every day there was one death that occurred in healthcare professionals. And that's suddenly when the alarm bell started ringing that there's something particular about COVID and healthcare professionals, particularly ethnic minority healthcare professionals. But it's been very sad to see. Unfortunately, we've had even more of an impact in ethnic minority populations and deprived populations through COVID, not just the healthcare professionals, but the public out there as well.
Reassure us, because there's lots of listeners who are concerned about this. I've had my third jab now. Others have had both the jabs that they're required to take. Cases still rise, though. Why are cases still going up? What's the medical reason? And you're doing this from a position of being a member of SAGE, which is, the top body advising the government on this. And should we be worried about the number of deaths that are still occurring?
I think this pandemic taught us a number of things. It's very unpredictable. Even the best brains in the world have got things wrong. We're not sure how it's behaving. It's a very dynamic situation with what's happening in terms of populations doing, what the country's doing, and how the virus is behaving, especially with the mutations that are occurring. The question of why we're still getting the infections, well, vaccinations protect you from getting severe disease. The Delta variant we've had, unfortunately, you can still get the virus, be asymptomatic and pass it on. It doesn't completely dampen you not getting the infection. I've been double jabbed, but I still had COVID and I had quite severe flu-like illness. But I dread to think what would have happened if I hadn't had the double vaccination. So I think it's imperative that we do continue getting our double jabs. And if you're due a booster, then definitely get a booster. I mean, I was listening to Dr. Forsey yesterday, and a number of people saying that maybe we need 3 vaccines to protect ourselves completely. So that's the double jab and the booster. Everything else we must continue. We seem to be losing our guard against wearing masks. I was on a train in London, and less than 20% are wearing masks. Masks reduce infection by 50%. Washing hands reduce infection by 50%. And physical distancing reduces infection rates by 25%. So they're so important. And then obviously, finally, lateral flow tests, if you're going to big gatherings, must continue those as well.
In terms of the link between the ethnic minority communities and coronavirus, there was those figures that came out right at the start that 1 in 4 of the admissions into our hospitals were people with diabetes. You have now been acknowledged as one of the leaders of research as far as coronavirus and the ethnic minority community is concerned. Tell us about the 3 grants that you all have received to try and get to the bottom of why this has happened.
So we've been very fortunate because we probably have the best databases in the world with the Office of National Statistics and NHS Digital. So we're putting grants in collaboration with Office of National Statistics. And we've identified a number of areas already published from the 3 grants, and one we've just recently had. And the kind of things that we're looking at, we have as ethnic minorities puts us at a much higher risk. Living in overcrowded areas and living in overcrowded housing leads us to increased risk. having certain types of occupations, so healthcare professionals, key worker roles, all of those put us at much higher risk. So a number of results have come out of this, and they have informed policy. The other areas of work where we're doing our vaccine hesitancy. Ethnic minorities are more hesitant to vaccines and why that's the case, and looking to see how we can improve that. So our Center for Ethnic Health Research has been helping to get infographics, information out to ethnic minority populations about the importance of getting vaccines as well.
This is Keith Vaz on Talking Points on Leica Radio. I'm talking to the world's #1 doctor on type 2 diabetes, Professor Kamlesh Khunti. When we come back, we're going to talk about some of his other interests, and also he's going to choose his favourite song. Join us after the break.
Talking Points with Keith Vaz, celebrating diversity. Leica, London. Leica Radio.
Welcome back. This is Keith Vaz on Talking Points on Leica Radio. I have to tell you, I've only pursued 2 people doggedly in the last year, and out of the 2, only one now I have left. One was Narendra Modi, the other was Kamlesh Khunti, and finally I've got him on the program. He is the world's #1 diabetes specialist, rated #1 in the entire globe for type 2 diabetes. Kamlesh Khunti, you do so much. You do the Leicester Diabetes Centre, you've got your own practice, you are a professor of medicine, you choose people to do medical courses. What do you do in your downtime?
Well, Keith, I probably don't have as much downtime as I would like, but most of my downtime really is spent with my family. My parents used to live with me. Unfortunately, both passed away, but my father did have important family. So all of us sit together on a Saturday night. My brother comes around, we have drinks together and eat together. And during the pandemic, I was working every day, and right early on, they started making me cocktails to give me a message that I should now join them in the kitchen. And we've carried on making cocktails, and we put them on Twitter, and that's become quite an event on Saturday nights.
Is being with your family and spending time with your family, is that a way in which you keep up with the heritage? Because as you look at your life and see what you've achieved, incredible achievements in the last 5 decades or so, is this how you keep alive who you are?
I think the most important thing to me is my family. And as I said, we were brought up in Highfields in Leicester, very in the city, and our highlights were weekends when mum and dad weren't working. The uncles and aunts would come along, and we'd eat and sit and eat together and have a chat together. And that, even now, those memories have stayed as some of the best memories I have. And we've tried to instill that into our children as well. And fortunately, so far, it seems to be working. We still, if they're at home, we will try and eat together most evenings, but at weekends, we try and eat together most of our meals together.
So did you encourage, or did you try and suppress your son's wish to become a doctor, having been through it all yourself?
Yeah, no, we didn't suppress it. We gave him a lot of options, as one would discuss. There were so many careers one can go into. So Nitisha is the eldest, and Sachin, my middle one. They've both done medicine. They did pharmacy and then went to medicine. My youngest, Nehal, has done pharmacy. But when you talk to them at weekends, I think the happiest from them all seems to be Nehal, who did pharmacy, because she has a nice 9-to-5 career, while the others are still doing nights and evenings and weekends on call.
Tell me someone you admire in the world. It doesn't have to be anyone in the UK, but a leader who you think you would like to meet and spend, a weekend in a desert island with. Someone who you think really makes the cut as far as leadership is concerned, because you yourself are a leader in medicine. Which leader in another area do you admire the most?
When it comes to leadership, my father wasn't a leader, but he's probably my role model. Keep it simple, keep it humble. It's a real difficult one in terms of national leaders. There's just so many to choose from. I think I'd have difficulty choosing one particular one. Being on stage, I must say I've been hugely impressed with the way Chris Whitty and Patrick Vallance have dedicated all their time to the pandemic. I just see how hard they work throughout, 7 days a week, and it's real admiration for them.
And what about the future of the NHS, an organisation that you are an integral part of? What can we do to make the NHS secure and stable for the future?
Well, I would say more funding, as anyone else would. I think NHS is still the best healthcare system in the world, cradle to grave-free at the point of contact. There's not many countries that can say that. I know we have had difficulties over the last few years, but I think if we put more funding, I think we are also leaders in terms of models of care. Every other country, the doctors look after diabetes. In the UK, we have pioneered that if we train nurses to a high level, they can look after diabetes as well as doctors, so doctors can then concentrate on other things. Now I think we're coming to an era that we need to train even more different healthcare professionals, so healthcare assistants, pharmacists, all of them can deliver high quality care. That would leave the doctors to do the more complex areas, because people are getting more and more complex with having lots more diseases. So the investment needs to be there, but I think we need to start thinking outside the box of new models of care as well.
Kamlesh Khunti, it has been an honour interviewing you today, even now, more so since you have been rated as the top diabetes specialist in the entire world in type 2 diabetes. We always ask our special guests to choose a song that is special to them and to dedicate it to someone or some people who is special to them. Which song would you like to choose and who would you like to dedicate it to?
As always, I will dedicate it to my extended family. Zindagi ka safar hai ek safar from the film Andaz, and that basically means what a life it is, what a journey it is. No one understands it, and I think that's been my life. I'm not sure how I got here, but I did.
Well, we're glad you did. Kamlesh Khunti, thank you so much for joining us. Please take with you our thanks to everyone who works with you in the NHS and to you for the leadership and the skill in which you do your enterprises.
Keith, thank you so much. A real honour to be on.
Let's hear Professor Kamlesh Khunti's first song.
जिंदगी का सफर है ये कैसा सफर कोई समझा नहीं कोई जाना नहीं जिंदगी का सफर है ये कैसा सफर कोई समझा नहीं कोई जाना नहीं है ये कैसी डगर चलते हैं